So what are the impact of these two studies for our care of obesity patients? The first thing to recognize is that both of these studies evaluated extremely obese patients, so body mass index above 40. So these results are not generalizable to the more average overweight patient that we are taking care of. That said, the impact of these two studies is very consistent. Both of them identified increased mortality associated with this extreme obesity. The biology of that is not entirely clear, but certainly in the second study, it indicated that access to angioplasty and all of the complications that can occur in extremely obese subjects plays a role. So cardiologists need to be aware and take note of these studies. So what advice would we give to practicing physicians for the care of extremely obese patients? Number one, recognize that extreme obesity is a risk factor, not only for increased rates of mortality in hospital, but complications due to access. Not necessarily bleeding complications, but other issues, as we saw in the second paper, related to increased nephrotoxicity and dialysis. So care and attention to weight-based protocols, working with your hospital to have the right equipment to handle these extremely obese patients is important. And again, to reiterate, these were studies examining extremely obese patients. The obesity paradox, where overweight patients actually do better than underweight patients or extremely overweight patients, remains. And we need to know more about that because, again, there may be things that we should be doing differently for our very lean as well as our extremely obese patients that could improve outcomes to match those of our overweight patients.